My name is Danette Ramsey. I'm a student physical therapist assistant at Jeff State, and today I'm going to talk to you about my patient treatment plan. I'm going to give you a brief introduction of my patient and her history, one joint mobilization or soft tissue. I chose soft tissue. And one patient education activity, one home exercise, and the expected healing time for my patient. My patient was a 65-year-old female referred to physical therapy for treatment of a thoracic compression fracture, specifically T8. The patient's history is that the injury occurred about 2 weeks ago after twisting to reach something in her kitchen, and the patient also has osteoporosis, which means that they're at an increased risk for more injuries. During the initial evaluation, the patient complains of deep, sharp pain in the thoracic area. The patient is unable to make her bed. She has limited sit time, less than 20 minutes, but has no past history of falls. She presents with a kyphotic posture and protracted scapula. She also has a decreased lumbar lordosis. There are also spasms palpable at the bilateral thoracic paraspinals from T6 to T10. I chose to do my soft tissue mobilization on the hamstrings. It should be performed bilaterally. This will loosen up the fibers and allow the pelvis to be in a more neutral position during standing. This will also assist in improving the patient's gait deviation. The soft tissue mobilization I chose to use was on the hamstrings because the patient has a posterior pelvic tilt, and loosening up the hamstrings would allow the pelvis to be in a more neutral position. So I'm choosing to do elongation on the hamstrings and also removing any knots that the patient may have. Sorry. And when you're doing the elongation on the hamstrings, you would want to do it to both sides. That way the pelvis can be in a neutral position. One impairment that needs to be addressed is their weak scapular stabilizers. So one exercise that we could do for that is scapular squeezes. The patient's just sitting there with their arms by their sides, and you bring your shoulders back into a retracted position, and you're going to squeeze your shoulder blades together. And you really need to focus on holding that contraction for at least 5 seconds. And you would do 2 sets of 10 repetitions 2 times a day. Alright, Ms. Prince, today we're going to work on scapular squeezes, which is working your rhomboids, which will help your posture. Okay, so I'm going to demonstrate it for you. You're going to stand with your elbows like this. Keep your elbows tucked in and squeeze your shoulder blades together. And you should feel the contraction right here. Do you have any questions about that? Okay, you'll need to do 2 sets of 10 repetitions, and you'll need to hold the contraction for at least 5 seconds. And you need to take rest breaks whenever you need to. Okay. Posture should be the main impairment that should be addressed in patient education. If this is not right, then it can affect everything else. So we should fix the patient's rounded shoulders, their retracted scapula. We should tighten their core and strengthen their neck extensors. The patient should also avoid positions of trunk flexion and anything that causes extreme pain during healing times.
So what we're going to do today is address your posture in our education portion of this video. You have very rounded shoulders and protracted scapula, so we need to strengthen your back muscles and stretch the front portion of your chest. Okay? Okay. So what you need to do is you need to be more aware of your posture. So we need to sit straight up and kind of roll your shoulders back. You'll feel a little stretch here. So you'll need to focus on squeezing your shoulder blades together, right in here. And you need to focus on tipping your chin back, just like that. Okay? Okay.
Since the injury is to a single vertebrae, the patient should be able to return to their normal level of prior function before their injury. The patient does have osteoporosis, so healing time may be delayed compared to a person that does not have osteoporosis. Usually healing time is about 8 to 10 weeks, and for someone with osteoporosis, it may be about 12 to 16 weeks before normal healing occurs. As I stated before, proper education is necessary since injury can now occur more easily. Some modifications may be necessary, such as a normal exercise program in order to strengthen the back muscles and maintain the retracted scapula that the patient has, and also this will decrease the bone deterioration from osteoporosis. After 4 weeks of therapy and a home exercise program, a reevaluation was performed. The patient stated that she was compliant with the home exercise program, but still had pain with making her bed. Her posture has also improved, but still needs work. There are now no spasms palpable in the thoracic area, and she has minimal pain at T8. The goal is to continue with improving balance, overall conditioning, and body posture, and also body mechanics education.